Research shows suicide rates among Black children and young adults are increasing at an alarming rate, faster than any other demographic. Today, the CDC released results from a study into suicide rate changes by ethnicity and age. Evan Watson has been looking into this, and Evan, you talked with local activists who say this needs immediate attention.
Ashley, this is a difficult, of course, but important subject that we've covered here at KGW. Not only does research show Black children are dying by suicide at twice the rate of their white peers, but the most recent research shows the suicide rate is increasing.
It is heartbreaking.
Suicide awareness advocates are trying to make sense of the numbers.
It's the highest rising suicidal population in America.
New data published in a CDC report shows a 36% increase in the suicide rate for Black people between the ages of 10 and 24. Researchers studied the change between 2018 and 2021. No other demographic group experienced as significant an increase.
There's going to have to be more effort to educate, to raise awareness in the communities of color of what emotional wellness and mental wellness actually means.
Daryl Turpin is the director of equity and cultural engagement for local suicide prevention agency, Lines for Life. He says the rising suicide rate among Black youth is a product of some of the root causes of mental illness and emotional instability.
What has occurred with gentrification, the relocation, poor schools, lack of economic development and opportunities.
Racism, bullying, and trauma tied to violence are often associated with this increase as well. Turpin says he learned from conversations with his son that suicidal thoughts can present in different ways.
You may not say you're suicidal, but if you don't care if you live or die, what does that mean? Suicidality does look different in the Black community. Our reaction and response to trauma is very different.
He says perspective on this problem is important.
Viewing this not just as an African-American problem, but a problem that our entire community are facing.
But says in his work with the community, he sees reasons for hope. Among them, the growth in willingness to talk about mental health and reduce stigma about the need for support or treatment.
My grandparents had resiliency. They always told me trouble doesn't last always. And I believe that now.
There's some current actions being done about this right now. Lines for Life in the Multnomah County Health Department is hosting a healing summit at the PCC Cascade campus on Saturday to talk about suicide and what's needed in our communities. Lines for Life also has a racial equity support line, 503-575-3764, where Black Portlanders can call and talk to Black staff about anything they need. And remember, the number for the National Suicide and Crisis Lifeline is 988.
Such an important number. All right. Thank you so much, Evan.